My name is Ann Merkel, and I'm fortunate enough to be here today with my friends who were so instrumental in starting High Peaks Hospice. And at the request of the hospice, we're all going to reminisce a little bit and go over how this was possible to start a hospice in a rural area, since it was so difficult for even big city hospices at that time to get all of the required services by the various regulations. In 1986, the government decided that dying was no longer an admissionable to a hospital, diagnosis. And so people had to go home to die. But it was very difficult for public health to all of a sudden take on this extra public health really emergency. And it was so difficult for the families. My husband then, David Merkel, was a surgeon, and we began getting calls at home with people just desperate about what to do. And I had grown up in New Haven, Connecticut, where there was a hospice. And I just took it for granted. Why weren't these people going to a hospice? And guess what? There wasn't one. Because it was a rural area. And at the time, I was doing some volunteer kind of board committee work, and fortunate enough to know some people to tell me why this was such a problem. And when we started going and talking to various organizations in the Tri-Lake area, such as churches, fraternal organizations like the Moose and the Elk, and really just any group. Number one, they wanted to donate money. Number two, they wanted to volunteer, and they wanted to refer patients. It was such a surprise to me, particularly that volunteers in all specialties came forward to fill requirements required by the regulations. And speaking of the regulations, I went to the hospice near New Haven and received the training. And then I asked Katrine Kretzer if she would give me a copy of the regulations for a hospice. And would you like to speak to that, Katrine? I almost passed out.
Well, at the time, the Franklin County Public Health was the only certified home health care agency in Franklin County. So when the regulations were dispersed, they were given to us to look at to see if this was something we wanted to undertake. And we were struggling at the time. Patients were being discharged from home, a lot sicker than previously. There were a lot of demands on the agency. So I went down to the training in Syracuse for 2 or 3 days over the regulations and brought it back to the county, and realizing that between needing to have fundraising, volunteers, and cutting across county lines, which of course with the county wasn't allowed, that, it was maybe another venue needed to be established to have hospice given to county residents. So Ann and I started to work on the regulations together, my being a little bit more familiar with them at the time.
Yes, I guess so. And I was so grateful because Katrine also put me in contact with what I will call the Old Girl Network, which was a basis, really an important basis for the hospice to begin. And that was the directors of public health in the neighboring counties where the hospice would be starting to provide. And those wonderful professional women stepped forward, educated me in each county, and with Katrine's help, I learned the regulations. I didn't like it, but I did it. And knowing that, and knowing I had the backup of these wonderful professional women, made so much difference. And when I read over the regulations, they required things like a pharmacist who was a compounding pharmacist and would be on call 24 hours, all the time, in other words. Luckily, Jim Bivalacqua he was here in the Tri-Lakes area. His family had owned post office pharmacy for many, many years. And he stepped forward and said, I would like to do that. I would like to volunteer.
I was part of the original High Peaks Hospice Board when it started. They did need a pharmacist on board, and I was more than willing and happy to accommodate that position. In those days, it was just getting started, so the pain management was funky, so to speak. There wasn't a lot of options, and nobody knew where to go to get help or what to use. I can remember making a Brompton's mixture, which was cocaine and morphine mixed in gin. You made a great big quart of it usually, and gave it to the patient, and they took that as needed. And of course, once you took one little sip of that, you were addicted or whatever, but you also got great pain management. You probably slept a lot, but it was what was available at that point in time.
And then we had people like Father Dennis, who stepped forward to help develop and actually write the spiritual care component of the volunteer training program. And to this day, to my knowledge, the hospice still uses the things that he wrote, the articles and the training materials. Would you care to speak to that?
Well, don't make it sound like they were the 10 Commandments or something.
I thought they were.
But no, it was an honor and a privilege to be associated with hospice. I knew of the group nationally, but it was a real pleasure and a challenge too for me to get involved at the local level where you do the work. And I was impressed with the talent that you and David and Dr. Bob and everybody else assembled, and still am to this day. I haven't found a better group of people.
How nice.
So it's something that I've enjoyed a whole lot.
If a family did not have a minister or a member of the clergy and wanted one, you would step forward and provide that care for them. If they did have one, Rick would contact that clergy person and they would work together, and it was wonderful. And then Sister Camillus, my wonderful friend, we served together on quite a few committees associated. And perhaps you would just say a few words about what you were doing at that time.
Okay. At that time, I was the administrator of Eli Mercy Center. And I was hearing and reading a lot about resistance at the time of having hospice services come into nursing homes. The idea that was expressed by many was that wasn't it just a duplication of what the nurse in the nursing home was doing anyway? And one day I remember I looked at the agenda and I had a meeting, and I thought, oh, okay, another meeting. But it turned out to be a very special meeting because the meeting was with Ian. And we talked about how do we get the regulators the public to see the value of having hospice come in to nursing homes. And we talked about it quite a bit.
Yes, we did.
And after the meeting, I went my way, and Ann took those words and added wisdom to it. And lo and behold, hospice became part of and admitted to nursing homes. And I have seen personally the value, the effect of having hospice people come in.
Sister allowed me to bring over people in the training program, usually 8 in a group, to talk with patients in the nursing home. And it was really on-the-job training. It was a wonderful experience and gave volunteers the opportunity to think about, did they wish to volunteer in the office or work like that, or did they wish to work with patients and families? It was a wonderful experience, and I don't know of another facility that helped a hospice like that actually have that experience. And we'll all be so grateful to you forever for that. That was very important, sister.
I think it was mutually of value.
Oh,
I
right,
think
yes.
we learned a lot too.
And of course, Dr. Koselke, my husband was David Merkel, and at the time, he was very busy, not only with the surgical practice, which they were both members of, but with his obligations to the Army Reserve. And he and Bob shared a lot of the medical director work at that time, but Bob was the first medical director and traveled extensively around the nation, visiting hospices and National Hospice Organization meetings. And we're grateful.
Well, thank you. And my recollection of way back when we were just an idea,
Yes.
which I thought relative to other ideas, especially in medicine, especially in medical care in New York State, it takes from idea to actual, I guess you would say brick or mortar, actual hands-on, it takes years. And we were able to get this whole concept sort of formalized, get the regulations, get this, something we call in medicine the Certificate of Need, or CON, which you can't get off the starting line with New York State unless you have a Certificate of Need. I remembered my battle buddy, Dave Merkel, her husband, he ended up taking, I think it was like 21 copies of the Certificate of Need. Each of them had to go to a specific desk at the New York State Department of Health. And he had, I think it's called a creel.
Yes.
It looks like a woven basket, a pack that they use for fishing. He stuffed all these things in a creel, brought them down in person, brought them down to Albany.
Yes.
And went to the Department of Health, parked in the parking lot, and took his creel and went specifically to every designated receiver of this CON and said, here you go, here you go, here you go. And I think we
Yes.
had our approval. Most places, hospitals have to go through this also. Just to add one bed, they have to have a Certificate of Need. It'll take a year, 2 years for them to say, okay, thumbs up, worse than that, thumbs down. We had our Certificate of Need approved. In other words, we got the ready to go sign within 6 months. All right. And just reiterate my memories a little bit more about the start of hospice. I think about this quite frequently. It's not just every 5 years or some sort of intermittent time frame, but I think a whole bunch of things came together in a positive sense, a perfect storm. The regulations about Medicare would definitely a contributing factor for people to start thinking about what was known as hospice care. Our neighbors up north in Canada had a formal hospice organization throughout all of the whole east to west in Canada. England had one. So there was a case that this would work.
with terminally ill patients, if they had Medicaid, it was fine because the extra costs would be picked up by Medicaid. But the problem occurred, and that's one of the real benefits of hospice, is that Medicare will cover all costs. So the patient doesn't need to think about, I need to get onto Medicaid, I need to have my medicines covered, my dressings covered. And we used to struggle with that with our terminally ill patients prior to hospice. Hospice just takes care of all those costs, which is a real plus.
The miracle of this whole thing, sister, I call it a miracle, is that it didn't have any hiccups. Once we had this idea and we started the process, it's sort of like in the 60s, when you and I were hippies. They used to call us a grassroots movement. Remember that term, grassroots? And it became solid. And so from all those things I described to actually seeing patients was like 2 years.
Yes,
Something like
it
maybe
was.
even less than that.
Uh-huh.
And
Definitely.
we had people who had faith in the movement. We had people who actually had empathy for others, and all sorts of positive personal qualities and characteristics that, when you put them all together in union, they were strength, and the whole thing just marched down the street, and we became a hospice. We had this whole thing, I think, streamlined and running with a lot of help from people. People donated office space to us. Actually, Ann had the first office in her, I would call it your den.
It was amazing, the space that was donated to us. And Madden's Moving and Storage provided office furniture that they had. And so that was wonderful.
Yep.
And just so much was donated. And it just came voluntarily. We didn't ask. And that's the North Country. That's the difference.
The original volunteer coordinator was Alice Scallon, and, she's been a steady force in this community for a long time.
She put in probably the most volunteer time. It was something that was very dear to her heart. And the volunteer records, when you're bringing people in and training them to go into other people's homes, the records are very extensive. I'm sure Katrine would agree.
I remember that.
Yes. And I was just so grateful for her dedication. And as for the health department, they couldn't believe it. And they sent their strictest surveyor up here to look over every little thing, and we passed.
Yeah.
And everyone was surprised. And in the years that followed, our model was copied in other rural areas. And because of the work done here by all of these guys and a lot more, I became president of the New York State Hospice Association. And my mission was to bring hospice everywhere in New York State. And it happened because rural areas now know, or then knew, that we could do it. An important part of the hospice program is the bereavement care that is provided to the family and friends following the death of the patient. And this was very, very, very important. And Andy Fortune was so active in this program and just did amazing things to help the hospice get started.
I found my way to High Peaks Hospice through Ann Merkel, and she and David and Dr. Kasulki, and among others shortly after that, joined the crew. It was a little intimidating for me. I was younger, and I just wondered exactly what I would be doing. And well, it came pretty easy to me, and with the guidance of the nursing people and others that have had a lot of contact with people in bereavement over a long period of time. My most profound experience was with an angry husband. When I went to speak to him, we had problems with eye contact and the rest, and he was very angry at me, but I persisted, and we talked about maybe the things that his wife would be feeling and his children, obviously. After a while, he kind of calmed down, and we turned out to be friendly, if not friends. Well, some people didn't use the bereavement trail, I guess, trying to, and that's the same, with my profession as a funeral director. Not everyone wants to do that. So, we had to be sensitive to that, and we were, and I think it was a very successful program over the years.
When going other places or having other people who want to start a hospice come to visit us, that not all of them had the benefits of people and facilities like Jamie Whitten and Will Rogers, where we are today, and Sister Camillus, who opened up a patient care facility to our volunteer training program. It was a wonderful experience, and just so rewarding. We expanded, of course, from the Tri-Lakes area, and I just briefly will say that Elizabethtown had a group interested in hospice care and came to us, Lynn Loopy, and said, would you extend your care into our area, which was very wonderful, and we did that. And from there, we were down serving the north part of Fulton County, and we also served a slice of St. Lawrence County, and eventually went into Warren, and of course, Queensbury has become a hub of the hospice. I am very grateful to all of you, my friends, for coming today and for making this recollection of how the hospice started. I am glad that the hospice wanted it made and initiated the thought, and I think it will go on forever.